All right, we have an audio check for the press conference beginning at 11:30. We have an audio check. And you're not hearing it. All right, testing audio for the live stream of the Fellowship for School-Based Mental Health press conference. All right, testing audio for the UMB Fellowship for School-Based Mental Health press conference. Testing audio for the UMB Fellowship for School-Based Mental Health press conference. One member of the media here. We have other people watching on the live. Okay, equipment will be okay. Yeah, the canopy will hold it. Yeah. Okay, is everybody kind of ready to go? Yeah. So I'm going to introduce, and then I'll introduce each person or group. Welcome to the University of Maryland, Baltimore. I'm Alex Lukowski, Assistant Director for Communications. Thank you for joining us this morning for this press conference where we're going to unveil a wonderful program that is going to accrue to the benefit of not only the students, some of whom you'll hear from, but also public school children all across Maryland. So to begin, to tell you about this program, let me introduce our Dean of the School of Social Work, Judy Postmus.
Thank you, Alex, and thank you all for joining us today. Appreciate you being concerned about this. As Dean of the School of Social Work, I'm so proud of this program and proud of the Center for Restorative Change and their team who put together the application to work with Coppin University and UMBC along with our School of Social Work here. In case you don't know, our School of Social Work, our mission is to train and educate practitioners, clinicians, scholars, leaders in order to impact the lives of individuals, families, and communities, and to promote economic, social, and racial justice. I'm proud of the work that we do here at the school, proud of this particular new initiative and developing a pipeline to get more of our social workers and more of our graduates in the public school systems across the state, and excited to be here. So thank you.
Thank you, Judy. Now let me bring up the Executive Director of our Center for Restorative Change, who's also the primary leader of this coalition, Dr. Wendy Shia.
Thank you, Alex. Since the start of the COVID-19 pandemic 3 years ago, recent research suggests that nearly 143,000 children in the state of Maryland developed anxiety and/or depression. As a result, lack of access and availability of quality mental health providers, particularly of diverse backgrounds, and especially in districts like Baltimore City, have become a critical issue. To combat these mental health issues, many school districts sought to quickly hire and expand their team of mental health professionals to meet their district's needs. However, school officials have cited that their districts are unable to meet the growing need for mental health professionals in their districts because they are unable to recruit and hire enough qualified mental health professionals to do this critical work. In response to this feedback about the lack of availability of mental health professionals, and particularly mental health professionals who represent the racial and gender diversity of the students they serve, the Department of Education issued a proposal seeking workforce development programs designed to increase the number of mental health providers in schools. The University of Maryland School of Social Work's Mental Health Services Demonstration Project, we call it the School-Based Mental Health Fellows, we call our student fellows, is designed to bring together Coppin State, a historically black university, and the University of Maryland, Baltimore County with UMB to build a pipeline leading from social work students' undergraduate education into the Master of Social Work program, and then eventually to place them either directly in a local educational system or into a position with a school-based mental health provider. Students still in their bachelor's program will apply to the fellowship in their junior year and then enter the master's program as an advanced placement student. So they will complete their graduate studies in 1 year. Undergrads will receive $1,000 a month stipend during the school year, a clothing allowance, training, support, and mentoring. Students already in the master's program, or those fellows who were supported as undergrads, will receive almost complete tuition, $1,000 a month stipend, training, mentoring, supervision, support, and eventually placement in a school mental health program. We've partnered with Baltimore City, Baltimore County, Montgomery, Howard, Anne Arundel, and Prince George's counties to place students in schools, both as interns and eventually as employees. We have a number of local mental health partners who work with schools who agree to accept interns and attend our job fair to recruit our fellows for placement in their agencies. We plan to have 105 fellows over the next 5 years. So we are super excited about this program, and I want to then pass it over to Dr. Melissa Buckley from Coppin State University. Dr. Buckley.
Good morning, or is it afternoon? Well, it's almost afternoon. For the past few years, we as a global community have been confronted with forced change because of COVID-19. Though we are no longer under strict protocols, we don't have to wear our masks, we no longer have to social distance as much anymore. What we do know is that we are still dealing with the ever-present effects of the pandemic, including an increase in anxiety, depression, and overall mental health challenges. Social work as a profession is uniquely positioned to respond to this ongoing crisis. Census 2022, it's raining now, reported over 500,000 Baltimore City residents, of which 61% were Black. A recent study by the Council on Social Work Education found that 2/3 of newly graduated MSWs in direct practice reported that the majority of their clients were living with mental health disorders, they were dealing with substance abuse issues, and 1 in 5 of them were disproportionately Black and female. These statistics have very serious implications for newly trained social workers. Coppin State University is one of the 4 HBCUs here in Baltimore City and houses one of 3 HBCU accredited baccalaureate programs. Though the HBCUs recently won a 14-year lawsuit regarding equity, scholars in our programs continue to experience challenges and barriers to their matriculation. Through this program, they will be able to afford to continue their education, as well as some of the supplementary expenses that will come up as a result of being in graduate school. This will inevitably increase the numbers of Black social workers who are professionally trained to work with the populations that I mentioned earlier. Coppin State University is pleased to be a part of this collaborative, and we are confident that the student scholars who we have identified, one of which is here, you'll hear from her momentarily, but we're confident that our scholars will not only serve with excellence, but they will inevitably pursue their MSWs, and they will deliver the professional services that they have been trained to do so. Mental health as a social work as a profession will be enhanced as a result of this grant. Thank you.
Well, I'm going to hurry up since we've got rain going. We have another of our other university partner is the University of Maryland, Baltimore County. Dr. Adrienne Akes is here with us, I think. There she is.
Hi, thank you for having me. The expected outcomes of this grant-funded program are to increase the mental health provider talent pipeline, starting with our undergraduate social work students from UMBC and Coppin and moving into the MSW program here at the University of Maryland. And then into clinical training and finally employment with the public school systems. The 105 social workers that will come, that are part of this, that will come from diverse backgrounds, they will reflect the community identities, ethnicities, racial makeup, and abilities and cultures of the students in the schools in which they will work. The social workers will address the shortages in the mental health workforce for our most underprivileged students in the public schools. At the same time, this grant provides funding to our current students to remove financial barriers while providing additional training and mentorship. Thank you.
And thank you for dodging the raindrops, if I can hang on to this. We have representatives from 2 of the school systems where the students will be placed. We have from Prince George's and Montgomery counties. Dr. Elizabeth Faison is Assistant Superintendent for Student Services at Prince George's County Public Schools. Oh, I thought she was here. Well, we have a representative from Montgomery County. as Stephanie Wallace, who is a supervisor of social work in the Office of Wellbeing, Learning, and Achievement at Montgomery County Public Schools. I know you're here.
I'm here.
All right, I'm your umbrella guy.
Thank you. Good morning. So I have 3 words that I would like to share with you: representation, connection, and engagement. Representation. Montgomery County Public Schools is the largest school district in the state of Maryland. We have over 160,000 students. Our Black and Brown students represent over 50% of all students enrolled. However, our current workforce is just 30%, just over 30% staff who are Black or Hispanic. In 2022 and 2023 school year, there were over 4,500 students that were referred for mental health services. 3,900 of those students accessed the supports of our school social worker, and over 500 were referred for our school-based mental health services. 70% of all students that were referred were Black or Hispanic. Connection. When students see themselves in those who work with them, paired with the commitment to culturally responsive and anti-racist teaching, students will feel connected. Engagement. With representation and connection, opportunities for student and family engagement will increase. I want to share a real-time look at how these 3 areas support the overall well-being of students and the school community. I'd like to tell you about a story of a social worker and one of our high schools and the impact that they have made. Jessica is a social worker. She's a Black female. Her primary caseload last school year were Black males. Just that alone is interrupting a cultural norm that has been established. Her school has over 40% white students and only 14% Black. I'd like to think that her students see themselves represented, they feel connected, and therefore are engaged. Looking more broadly with regards to school and community impact, in the 21-22 school year, that high school had 97 major incidents. Last school year, those incidents were reduced in half to 47. The principal recently attributed that gain to the presence of their social worker. With the creation and partnership of this fellowship, we will increase the diverse workforce that is needed to be able to continue representation, connection, and engagement.
Thank you. You know, they say rain is good luck on a wedding day. Maybe it's good luck for this program as well. The program really exists because of and for these students who are here. I'm going to bring up some of the students who are here in the program. Step right up. I can't handle. Oh, you have umbrellas. Okay, good. We have Janaea Jackson, Tyler Hall, Bianca Collins, Faith Rogers, and Ivan Flores. Come on up, and if someone doesn't have an umbrella, I can hold it.
Okay. Hello, my name is Faith Rogers. I am a student at Coppin State University. I have not identified an area for research, but I am interested in the African American youth in the criminal justice system. I anticipate that this grant will be beneficial not only financially, which would allow me the freedom to use my time developing my clinical skills, but also providing opportunities for hands-on learning. My future aspirations include providing mental health services for the African American community. I believe the mission of this grant aligns with my career goals to provide culturally responsive access to mental health care for African American youth.
That's great. Oh, we're going to trade. Well, we got.
This one says our school.
See, that's why she's the dean. That's why she's the dean. She has the big umbrella. Thank you. Who else wants to step up, at least say your names and where you are? I think people like to know that. You don't have to give a speech or anything, but.
Hi, everyone. My name is Tyler Hall. I am a MSW student here at the School of Social Work in Baltimore City, and I just want to say that I'm beyond grateful for this fellowship, the opportunities it's opening for myself and for the fellow students that I'll be serving. Thank you.
Right.
Hello, my name is Janaea Jackson. I am a student here at University of Maryland, Baltimore campus, and I am super blessed and grateful for this opportunity as well. Safe to say, I feel very comforted and I feel very supported, and I feel very blessed to be around social workers who look like me and who also want to see me do well. So thank you for giving me this opportunity.
Hi, good morning. My name is Bianca Collins. I'm an MSW student at the University of Maryland, Baltimore School of Social Work. I'm in my advanced year. My concentration is clinical. My specialization is families and children. I'm pretty much grateful and blessed to be a part of this program, and I appreciate the support from the staff, and yeah, that's it.
Hello, everyone. My name is Ivan Flores. I'm an undergraduate student at UMBC. I'm just appreciative for this opportunity to really be able to make a change in the school-based mental health. Uh, I've always wanted to go into it, so I feel like this is a great opportunity, not just for me, but for my fellow peers. And yeah, I look forward to it.
All right, we do have a media representative. If you have a question, the floor is all yours. If you want to ask any question, say who you want to get it from, and we can have him step right up.
I'd love to talk to the Director of Racial Justice. I was just wondering if you could speak a little bit more to like why it's important to have counselors in schools that represent racial equity.
Yeah, it's so important to have representation in our social work programs in schools. I was recently meeting with a child welfare worker at a local Department of Social Services, and one of the things she commented on was how many referrals they get from schools into child welfare that are inappropriate, and how many of them are by social workers or school staff who don't understand the lives of the children they serve. They don't understand the lives of the families. And so they very often, make decisions that are not useful to that family. And so we believe that representation doesn't solve every problem, right? We're clear about that, which is one of the reasons that we are doing so much work around anti-racism and anti-oppression, because just because somebody's of the same skin color doesn't mean they understand issues. So we're trying very hard to merge those two things, both the representation and the full analysis that will allow our social workers to be in schools and appropriately assess children based on very real data and not our biases and our prejudices. Thanks.
Also just ask like some logistical questions. I don't know if you're the best person to direct this to, but
Give it a try, and I have lots of support that I can call a friend.
I was wondering, like how the fellows were chosen to be in this program. That's the first question.
Yeah, so we worked the reality about this first year is that we got the grant and we had to execute within a month. And so we worked very closely with our colleagues at Coppin and UMBC and asked them to identify students. We really looked at students that were interested in working in schools and or already had a placement in a school or a youth serving institution. And so both UMBC and Coppin and our own field office gathered those lists of students together, and then they applied and they wrote great essays and they really showed their passion for the work. And so we actually had more applicants than we could accept this year. Unfortunately, we wanted to take them all, but we did accept one extra student this year because we just had so many great applicants. Yeah.
I was also curious to know if you know like what school district is going to receive like how many of the 105 fellows, like is there a breakdown for that?
I don't have that information. We have relationships with these multiple schools, and we've had interns in schools for a very long time. And so these are ongoing relationships that, the schools have come, but we know that we have a lot of interns in Baltimore City. We have a lot of interns in Montgomery County. And so we will continue to expand this year. Yeah.
Thank you. I was wondering if any of the students also would like to speak to like why you applied to this program.
Ready to go.
Can you just say your name again?
Okay, my name is Janaea. I'll definitely apply for this program, the School of Social Work or the fellowship.
The fellowship.
So I was super interested in being a school-based social worker anyway, so it was such a coincidence that this grant was available. But I can recall growing up in the city, and it really wasn't a lot of representatives that could understand where I'm coming from as far as poverty or hardship. So I definitely would love to be a part of that system that gives the child or multiple children a chance to feel supported, a chance to feel heard, in a way that not everyone might understand.
there's pay more emphasis, more just overall basis of it. Thank you.
Are there any other students? You don't have to. If anyone else wants to speak, go ahead.
Not all at once.
Hello. I wanted to be a part of the fellowship just because I want to be a part of the change. I've seen multiple programs in Baltimore, especially in elementary schools. I forget the name, but they're just teaching them about mindfulness and how that can really impact a child at a young age. I would just like to be a part of that, and I see the importance of that. So yeah, that's why I wanted to be a part of the fellowship.
Great, thank you. I think those are all the questions that I really had. Oh, wait, sorry. Go ahead.
So my long-term goals have always been to clinically make an impact on the lives of children and adolescents. And I wanted to work in a school setting. So when I found out about this program, I thought it was a great opportunity to, apply, shoot my shot, and, get the experience that I needed within this program.
That's it. All right. Well, thank you, and thank you everybody who's watching on the live stream, and we look forward to updating this story. And if you have any questions, you can certainly reach out to us. You can reach out to me at alikowski@umaryland.edu. That's ALIKOWSKI@umaryland.edu. Or Brittany Brookins. Brittany, you have a dot in the middle of it. You want to? Well, let's put a face to a name.
Hello, everyone. You can follow up with me for questions and comments using my email, bbrookins, that's BBROOKINS @umaryland.edu. Thank you for coming and thank you for watching.
All right, that concludes our time. And of course, it stopped raining once we were done. So maybe it is great luck after all. Take care. Thank you, Judy.